Hello viewers, today we are going to return to the world of MS-ENT or University Exam for Post-Graduation in Ear, Nose and Throat. Today's question is balloon sinuplasty. So let's have a look at the question itself. So this is the question. It was asked fairly recently in a university exam of MS-ENT. The question is, describe the basic principles, indications and complications of balloon sinuplasty. Now, I've underlined the key aspects that you need to address while writing the answer. But of course, you need to know what balloon sinuplasty is. Now, let's look at the answer that I think would be adequate for this particular question in the theory exam. So, balloon sinuplasty was first successfully developed and implemented in the branch of cardiology. Only in 2005, the United States Food and Drug Administration gave approval for the use of balloon sinuplasty for the purpose of enlargement of paranasal sinus ostia. Okay, so it's a fairly recent phenomena. Now, the basic principles of balloon sinuplasty involve the inflation of a pressurized balloon device within the sinus ostia, which dilates the ostia, and this is via local microfracture. This expands sinus outflow tract and also preserves the overlying nasal mucosa. So, for balloon sinuplasty to work, there must be an established sinus outflow tract. So, largely because of the anatomical nature of the paranasal sinuses, balloon sinuplasty is only useful in diseases involving maxillary sinus, frontal sinus, and sphenoid sinus. If you want to use balloon sinuplasty for ethmoid sinus disease, you may have to go for the hybrid model where balloon sinuplasty is combined with functional endoscopic sinus surgery. Now, what are the indications of balloon sinuplasty? The indications of balloon sinuplasty are same as the indications for functional endoscopic sinus surgery, with the important caveat that balloon sinuplasty is more suitable for maxillary, frontal, and sphenoid sinus diseases. So let's talk about it. The first indication is failure of prior medical treatment of chronic rhinosinusitis limited to maxillary, frontal, and sphenoid sinuses. Second indication is failure of prior medical treatment of recurrent acute rhinosinusitis, again limited to maxillary, frontal, and sphenoid sinuses. And third indication is obstructive scar tissue in patients with prior sinus surgery. They can undergo office balloon sinuplasty. Fourth indication is revision of isolated frontal, sphenoid, or maxillary early restenosis, either after functional endoscopic sinus surgery or even after a previous balloon sinuplasty. Fifth indication is treatment of sinusitis in an obtunded hospitalized patient, maybe in the intensive care unit. He may require endoscopic sinus surgery. However, you cannot do that in an intensive care unit, so you might as well opt for balloon sinuplasty. And the sixth indication is patients with unacceptable general anesthesia risk who may otherwise benefit from functional endoscopic sinus surgery, but because the general anesthesia risk is unacceptable, you opt for balloon sinuplasty. Now, when we have defined the indications, we also need to define certain important terms, such as, let's start with chronic rhinosinusitis. That needs to be defined to write a good answer. Now, we have opted for the definition as per American Academy of Otolaryngology, head and neck surgery. So, what is the diagnostic criteria for chronic rhinosinusitis? In this case, it is 12 weeks or longer of 2 or more of the following signs and symptoms: mucopurulent nasal discharge, which may be anterior, posterior, or both, nasal obstruction or nasal congestion, facial pain or facial pressure or facial fullness, or decreased sense of smell. And inflammation is documented by one or more of the following findings. Now, these findings may be endoscopic, they may be radiological, as you can see here. What are the findings? Purulent, that is not clear mucus or edema in the middle terminate or anterior ethmoid region, polyps in nasal cavity or the middle meatus, and or radiographic imaging showing inflammation of the paranasal sinuses. So we have defined chronic rhinosinusitis, which was one indication. Another indication was recurrent acute rhinosinusitis. Let's define that as well as per American Academy of Otolaryngology, head and neck surgery diagnostic criteria. So recurrent acute rhinosinusitis is defined as 4 or more episodes per year of acute bacterial rhinosinusitis without signs or symptoms of rhinosinusitis between episodes. So now we have a new term, acute bacterial rhinosinusitis. Let's define that as per American Academy of Otolaryngology and Head and Neck Surgery. So diagnostic criteria for acute bacterial rhinosinusitis is acute rhinosinusitis which is caused by or is presumed to be caused by bacterial infection. Now, when will a clinician think that acute rhinosinusitis is caused by a bacterial infection? If the symptoms or signs of acute rhinosinusitis fail to improve within 10 days or more beyond the onset of upper respiratory symptoms, or symptoms or signs of acute rhinosinusitis worsen within 10 days after an initial improvement. This is called double worsening. So this fulfills the criteria of acute bacterial rhinosinusitis. However, we still have not defined acute rhinosinusitis. So let's define that as well. As per American Academy of Otolaryngology, Head and Neck Surgery, acute rhinosinusitis is up to 4 weeks of purulent nasal discharge, which may be anterior, posterior, or both, accompanied by nasal obstruction, facial pain or facial pressure or facial fullness, or both. Now, we should also define purulent nasal discharge. Purulent nasal discharge is cloudy or colored, in contrast to the clear secretion that typically accompany viral upper respiratory infection and may be reported by the patient or observed on physical examination. Now, nasal obstruction may also be reported by the patient as nasal obstruction, congestion, blockage, or stuffiness, or may be diagnosed by the physician on physical examination. Now, facial pain or pressure or fullness also may involve the anterior face or periorbital region or manifest with headache that is localized or diffuse. So these are the indications, the definitions of pertinent terms associated with balloon sinuplasty. Now, we should also know about the contraindications of balloon sinuplasty. A very important contraindication of balloon sinuplasty is chronic rhinosinusitis with nasal polyposis. Also, if the sinus ostia are inaccessible due to concha bullosa or paradoxical middle turbinate or deviated nasal septum, then balloon sinuplasty is contraindicated. Balloon sinuplasty also contraindicated in aspirin exacerbated respiratory disease. Balloon sinuplasty is contraindicated in allergic fungal sinusitis, in hyperplastic sinusitis, in cystic fibrosis, in orbital wall dehiscence, in skull-based dehiscence. So all these situations. And of course, there are some important complications of balloon sinuplasty such as excessive bleeding, which may require nasal packing. Now, the entire appeal of balloon sinuplasty is its minimally invasive nature. If balloon sinuplasty leads to extensive nasal bleeding and requires nasal packing, then it sort of defeats the purpose. So one of the complications is extensive nasal bleeding, which may require nasal packing. And another important complication of balloon sinuplasty is early recurrence due to the limitations of the procedure. So there you have it, the answer